A big story that a lot of Canadians are talking about is how Federal Health Minister Jean-Yves Duclos would like to see mandatory COVID-19 vaccines across Canada. Now, Quebec is looking into the potential of a tax for the unvaxxed. To talk about this in a little more detail is our political reporter and Toronto Sun columnist Brian Lilley, joining us once again from Toronto. Brian, you've been following this story. Duclos says it's really up to the provinces, and Alberta Premier Jason Kenney's already said we're not implementing mandatory vaccines. What's the latest from our Prime Minister Trudeau?
Jason Kenney said no. Scott Moe has said no. In the past, Dr. Bonnie Henry in BC has said no. So far, we've had Blaine Higgs in New Brunswick say he's interested. Andrew Furey in Newfoundland say he's interested. In Quebec, bring out this proposal saying we will have a health contribution, which, to paraphrase Shakespeare, is a tax by any other name. So Justin Trudeau asked about it Wednesday around noon Ottawa time. What do you think? And he was very reluctant to say that he was for or against this, but sounded more in favor than not. I mean, we're talking about a province instituting an extra charge, which should be a violation of the Canada Health Act, something that Trudeau should be banging the table on and saying, no, we will not allow this. You didn't do that. And eventually, more and more questions. The reporters in the room drew him out. It took them about 6 questions before he was finally saying, look, we have to look at measures. We need to do what needs to be done, basically giving tacit support. He says he wants to see the details from Quebec, but he gave tacit support to this idea. Now, as we've discussed the other day, Hal, this is popular across the country, at least in theory. About 60% of Canadians say they would back this, including 54% in Alberta, according to Maru public opinion research. So this is something that is being used politically by politicians to get people who are vaccinated angry at the unvaccinated so that they're not angry at the politicians. That's my view on this. And I think that, they'll have their fingers up in the air, testing the wind, seeing which way it blows. And you could definitely see the PM campaigning to have every premier institute something like Quebec is talking about.
Well, we'll keep an eye on that story. Brian, the Tories and NDP were both outraged over reports that the Public Health Agency of Canada was tracking 33 million mobile phones during the pandemic and is looking for a contractor to provide that information once again. Isn't that really a violation of our privacy?
Well, yes and no. Mostly no. And I think I'll shock a lot of people by saying this. Look, I can go on Google. I think part of the outrage is almost that they paid for the data, because I can go on Google right now and just say, hey, show me the COVID data for Canada. Show me or where people are going. And they will show you how much time are people spending at transit stations, in parks, in workplaces. This is publicly available data, but it's all anonymized. It doesn't say Hal was not at the gym, Hal was actually out eating chicken wings. It doesn't tell you that level of data. It's just, how many thousands of people are normally in workplaces on a Thursday afternoon, and what does it look like now? That's really what they're trying to track. They're not trying to find out where you are and report you or anything like that. That's not happening. So I get why people should be concerned. I support the idea of looking into it, making sure it's done properly, but everything I've seen from provincial and federal governments and what Google releases and what some of the companies that do this release, your privacy was never in jeopardy. It is honestly saying there's normally 10,000 people at this location pre-COVID. There's now 2,000 or 5,000, and it helps them figure out where people are going, where the virus may have been spreading. It was more important earlier in the pandemic than it is now.
Oh, the wings, Brian, you know me too well. And by the way, salt and pepper are definitely my favorite here. Just keep that in mind. Now, Brian, even before the pandemic, provinces from all parties have been calling for more money from Ottawa to support our healthcare system. Let me ask you something. Is it broken?
The healthcare system is broken, and the pandemic has exposed it for people who refused to see it before. I mean, how many times have you interviewed somebody or spoken with somebody and they say, well, we need to fix our healthcare system. And of course, the automatic reaction from a lot of Canadians is, we have the best healthcare system in the world. We don't want the American private system. That's not what people are talking about. But there is a big discussion going on right now about, okay, as we come out of the pandemic, how do we fix it so that we've got surge capacity for intensive care units, for hospitals, so that we go through this every year with the flu, not to the same degree. This is obviously much bigger than the flu, but the flu puts our hospitals at breaking point every flu season. So, how do we deal with that? How do we improve? And that discussion has been put off for years by Prime Minister Trudeau. If you remember, he campaigned on stopping Stephen Harper's cuts to healthcare. Stephen Harper proposed that starting in 2017, that they would lower the annual increase. They would still increase healthcare funding, but it would be lower. Justin Trudeau campaigned against that, but then instituted that same plan when he got in. Premiers have been saying for years, look, you're not 50-50 partners in healthcare. I remember being at the Council of the Federation in Saskatoon years ago, and they all put out a statement. We're talking John Horgan, NDP, all the Atlantic premiers at the time were Liberals, Jason Kenney, Scott Moe, Doug Ford. So all of them across political stripes said, you need to do more. Trudeau said no. He's finally agreed, okay, we'll start the conversation. But the problem is, Hal, he doesn't want to fix the hospital capacity that you and I all know too well now. He wants to bring in pharmacare. He wants to get the federal government running your long-term care or nursing homes. He wants to build new things instead of fixing the broken things, and that's a problem.
Brian, the Biden administration is not impressed with the COVID situation here in Canada and has even advised against traveling to our country. Are things really that bad here, or is this maybe simply an overreaction by Washington?
Well, if it's an overreaction by Washington, what does it say about us putting out a travel advisory against going to the US? What, a month ago now? I mean, it's funny to watch Canadians get upset. Oh, how dare the Americans say don't travel to Canada? Well, we said don't travel to the United States before their numbers were even at the level that we are now. Things are actually worse in the United States than they are here in terms of community spread. But to get back to what we were talking about a minute ago and how our healthcare systems act, the reason that they, in most states, are able to deal with it better and not have as many restrictions is they have hospital capacity. They have ICU. So when people say, why can't we be like Florida? Well, they have hospital beds to put people in if they get really sick. We don't. And that's one of the major differences. So, is it a bit of payback by the Americans? Maybe. I can tell you, whether we're talking this or trade or other things, there's no love lost between Justin Trudeau and Joe Biden. This idea that they were going to be great friends has been proven false time and again. And we get no favors from the Biden administration. The idea of a special relationship between Canada and the United States has been taking a beating for many years and might finally be put in the ground during this current administration's term.
On January 1st, we saw tax increases that many Canadians were not aware of. April 1st, we will receive even more tax increases on carbon and alcohol. Brian, the timing couldn't be worse, with so many Canadians struggling right now.
It really is. So we saw the Canada Pension Plan premiums go up, and some people say, well, that's not a tax. It absolutely is a tax. It's a payroll tax, and it's the government takes money from your paycheck to go to a government program. That's a tax. I don't care how much you believe in what is happening. It's a tax. So that went up. We also had it's not exactly a carbon tax, but just see if I can get the name here quick. It's a industrial emitters tax that's similar to a carbon tax. That went up. That's something that industry is going to have to deal with. And you're right, on April 1st, what are we going to see go up? The carbon tax that consumers pay, but also they have an annual escalator tax for alcohol and things like that. So we've got inflation going on. This is a major issue for Canadians. The daily cost of living is going up, not just, oh, housing is through the roof. Absolutely, housing is through the roof. And we need to deal with that. But the cost of butter, the cost of meat, the cost of milk to put on your table, the cost of vegetables, all of it's going up. And then the government's taking more out of your pocket at the same time as people are struggling to make ends meet. That is not a government that's looking out for the middle class and those working hard to join it. That's a government that is putting their ideology before anything else. That's not what I expect from this government or any government. They should be looking after the needs of the citizens, not after making sure that their political philosophy is implemented. Damn the costs.
You know, you're right. It's amazing how much the groceries have gone up. I went out grocery shopping the other day. 3 little grocery bags, paper grocery bags, which were maybe a year and a half ago, cost me $150, $225. And I just had the basics, you know, some chicken, a little bit of meat, eggs, milk, some veggies. It's just incredible what's going on right now. Now, Brian, speaking of taxes, the Trudeau Liberals have been talking about a potential tax on homes that has many people concerned. Can you explain how it would work?
So this is an issue that keeps coming back for the Liberals. They keep denying that they're going to do it, even though in 2018 it was a policy proposal they discussed. Now, they did reject it then, but it keeps coming back around election time with them having to say, oh, no, no, we're not going to tax your personal or primary residence. And they said that in the 2019 election. They said it in the election last fall. And yet they keep funding organizations through the National Housing Strategy. I mean, this is how you know that it's not just a rogue bureaucrat somewhere. This is funded by the National Housing Strategy, a proposal to say, we will tax you for any home valued at over $1 million. And they're out on that is to say, well, most homes aren't worth $1 million. But here's the thing, in Ontario, that's 13% of all homes. You get into the Toronto area, it's even higher. You get to British Columbia, that's 21% of all homes. And in the Vancouver area, it's even higher. This tax would not be when you sell, you pay a capital gains tax, Hal. This would be a tax that would be assessed on you for living in your home each and every year, and then eventually you'd have to pay it. That's craziness. That doesn't actually lead to more affordability. And the proposal by this professor that the Trudeau Liberals keep funding, UBC professor, it says take the money from homeowners and give it to renters. Why? Other than socialism, why? But they keep coming up with these plans. This was done, as I said, through the National Housing Strategy, through the Canada Mortgage and Housing Agency. If the Liberals want us to not believe that they want to tax our homes, stop talking about it. Stop putting it forward in policy papers. Stop funding studies on how to tax your home.
We're still having some trade issues with our American neighbors. Brian, where do we stand when it comes to pipelines, softwood lumber, and potatoes?
Well, pipelines is still an issue that the Americans won't move on at all. They're not interested in Canadian oil coming down, despite Joe Biden having to turn around and say, "Hey, OPEC, can you open up the floodgates a little because the price of oil is going
Wow.
up, the price of gas is going up. It's causing Biden real political headaches." We always say that they killed off Keystone XL because of the environmental movement. It was also because of domestic oil production in the United States. They wanted to make sure that that was protected. So there were a lot of reasons for that. But now the United States is looking at the price going up. They're looking at supply issues, and quite frankly, thinking they should have approved Keystone XL. But when it comes to softwood lumber, that's an ongoing issue. As we discussed a few weeks ago, that duty has doubled. And where are the talks on that? Where is the movement? That's not happening. There's a little bit of movement on the issue of PEI potatoes, which you remember there was a wart fungus that they were worried about.
Right.
Well, there's discussions, no solution, but discussions ongoing this week in trying to fix that. But there's not going to be any short-term solution that we can see. And in the meantime, we're talking hundreds of millions of dollars to an economy that is 160 odd thousand people, maybe a little bit higher is the total population of Prince Edward Island. This is their number one export issue. It's right up there with tourism and how that island survives economically. And they're being hurt badly by our closest neighbor, ally, and friend, which, as we've shown, whether it's on this or autos or softwood or oil, the Biden administration is no friend of Canada.
Brian, Canada's ambassador to China, quit to take a job with a mining company with major ties to China. Tell me more about that.
Yeah, so Dominic Barton, who we last saw, he was, helping the two Michaels get freed. I'm not sure how much he actually did on that, having spoken to people who were close to what happened and the talks that actually got them free. It was mainly between China and the United States. Canada was on the periphery and warned afterwards. So, this was the guy that we sent there to do that job because of his great ties to China. Well, shortly after that's over, he doesn't help with the China trade irritants, of which there are many, and of which he has business ties. No, he quits and he takes a job with Australian mining giant, with Rio, which has a a major presence in Canada, but also major presence in China. And his job is to expand their operations in China. This is being flagged as unethical, an attempt to use his position. I can definitely see the argument for that. That being said, Dominic Barton is someone who had too many ties to China beforehand, never should have been our ambassador, and he's someone who, according to the Americans, could end up being called to testify over his actions in China in terms of how companies operate while he was head of consulting firm McKinsey.
Political reporter and Toronto Sun columnist Brian Lilley, thanks so much for your time today.
Thank you, Hal.